Today's video is about peptic ulcer disease, which is a common problem among many of us. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related explanations are provided by our videos which are released every week. If you want to see such videos, subscribe to this channel. Also, press the bell icon adjacent to the subscribe button to get instant notifications whenever videos are released. This week's video is about peptic ulcer disease. The word peptic denotes digestive. Ulcer means a sore or an erosion. So that means there is an erosion or a sore in the digestive tract. Generally in the stomach and in the first portion of the small intestine called as duodenum. In the first part of duodenum you can have these erosions. These are called peptic ulcers. So why do these happen? We have to realize we have hydrochloric acid, a powerful acid secreted in the stomach. This is essential for digestion of proteins. So even our stomach muscles contains protein. So they can practically digest the stomach muscles. So how does this not happen regularly? There are equally important defense mechanisms against this acid action on the lining of the stomach. These are called mucosal defenses. So there is always a fine balance between the acid and the mucosal defenses, which leads to protection of the stomach but digestion of the food. Whenever there is an imbalance between these two mechanisms, it can potentially lead to this peptic ulcer formation. So what are the causes of this peptic ulcer? The most important cause which was diagnosed or which was discovered in the late 1970s and 80s is an organism, is a bacteria called as helicobacter pylori. So this helicobacter pylori is responsible for most of the ulcers. No, not what we feel as ulcer, but diagnosed ulcers. Most of them have helicobacter pylori as the etiological or as a causative agent. The second most common cause is irrational use of painkiller medications called NSAIDs. So these non-steroidal anti-inflammatory drugs which are commonly used as painkillers. So these painkillers, if taken inappropriately, can lead to peptic ulcer formation. Other risk factors might include stress, other lifestyle factors like smoking, alcohol, genetic factors. So all these can contribute to peptic ulcer formation. Rarely, even some forms of cancer can lead to peptic ulcer formation. Okay. So having seen the causes of peptic ulcer disease, what are the symptoms? What are the symptoms we have with this peptic ulcer disease? You can have a pain. This pain can be variously described as just a pain, pricking pain, sharp pain, gnawing pain. So all these sensations can be there, usually in the upper part of the abdomen. Okay, either in the center or lateralized to one side, you can have pain in the upper part of the abdomen. Essentially, peptic ulcer can be two types: gastric ulcer and the duodenal ulcer. Gastric ulcer is ulcer in the stomach. Duodenal ulcer is ulcer in the first part of the small intestine, duodenum. Symptoms sometimes can be different in duodenal versus gastric ulcers. Duodenal ulcers, usually eating food relieves the pain. Sometimes gastric ulcer, after you eat, the pain can actually increase. And you can have always ulcer pain, whether it is duodenal or gastric, usually correlating with food, either decreasing or increasing after food. There is a relationship with food intake and the pain. You can also have other symptoms related to the stomach like vomiting, nausea, indigestion or a bloating sensation. All this can be there. If there is a reflux associated with ulcer, you can have reflux symptoms like regurgitation also present. And these symptoms can be episodic. So you can have pain for a few days, then you can have pain-free intervals, again the pain can come back. So this pain can also be episodic. So these are the symptoms with which usually peptic ulcer patients present to. They can also develop complications. The complications can range from, especially if left untreated, can lead to perforation. That is, the entire stomach wall has ruptured. You can lead to perforation, which can be a surgical emergency, or they can bleed because the erosion or the sore can have some blood vessel running along it and it can bleed from that area. So there can be bleeding, which can lead to vomiting of blood or blood in stools, which can be black in color. So both these things can happen, or this can lead to stricture formation because of ulcer and healing and the associated fibrosis. So it can lead to stricture, thereby bowel can get obstructed because of the ulcer and the subsequent healing because of it. So all these can be a complication of peptic ulcer. So routinely the symptoms can be simple pain, vomiting, nausea, but because of complications you can have a surgical emergency, a very severe abdominal pain, and the patient may present in shock, or you can have bleeding, or you can have obstruction of the bowel. So all these can result due to the complications of peptic ulcer disease. How do the doctors diagnose peptic ulcer? So even though clinically you can have suspicion regarding peptic ulcer, the definite diagnosis is direct visualization using an upper GI endoscopy, upper gastrointestinal endoscopy, where a scope is introduced into the stomach and you directly visualize the ulcer. This will give 100% diagnosis of a gastric or a duodenal ulcer. You can also have investigations for proving this helicobacter pylori infection. So you can have similarly investigations for this. If there are complications, you may require additional further investigations. Based on all this, a diagnosis of peptic ulcer disease is made. How do we treat it? You can have treatment depending upon the severity. The simplest symptomatic medicines is an antacid drugs. These are not treating any part of the peptic ulcer itself, but by neutralizing the acid, you can have relief in symptoms. So these are used for temporary relief. You can have other drugs which reduce acid formation or acid secretion itself, like H2, histamine blockers, or proton pump inhibitors. So these group of drugs can be used to reduce the acid secretion, but essentially by reducing acid secretion, you allow the ulcer to heal. If Helicobacter pylori is the cause, a course of antibiotics is a must. There are specific antibiotics which work against Helicobacter pylori. So after a proper diagnosis with the physician, with the doctor, you can have a course of antibiotics to completely cure this Helicobacter pylori infection. In fact, if this is a cause, unless you treat with antibiotic, the ulcer will recur again and again. So a simple symptomatic medicine like antacid is not the solution to treating an established gastric or a duodenal ulcer. You need to have proper treatment for the proper duration of time. Rarely, if you have or if you develop complications, even surgeries may be required for established ulcers with complications. What about diet aggravating ulcer symptoms or diet causing ulcers? Usually, even though hot foods or spicy foods are considered to be the cause for peptic ulcer disease, via well-established scientific studies, it has not been proved that food being the predominant or the most important cause for peptic ulcer disease. These are unregulated drug intake, stress, and more importantly, this Helicobacter pylori infection. So if you have an established ulcer disease, don't blame it on food alone. But can spicy foods aggravate the symptoms? Yes, spicy foods many a time cause dyspepsia or indigestion, so may sometimes aggravate the symptoms. So while on treatment, or if you develop frequent symptoms, it is prudent to avoid very spicy diet. But spicy diets alone are not the reason for the causation of this gastric ulcer or peptic ulcer disease. Depending upon your doctor's advice, you may consume foods normally. More important than spicy foods, it is articles like alcohol or smoking which are more important in weakening these mucosal defenses, whereby it can lead to ulcer formation. Even coffee or tea, caffeinated beverages can do this. So it is important to avoid these kind of lifestyles and foods rather than worrying about spicy foods alone. Hopefully, this video would have given some insights regarding peptic ulcer. If you found this video useful, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.